Panic attacks and strokes are two distinct medical conditions that often get confused due to some overlapping symptoms. Panic attacks are sudden and intense surges of fear, panic, or anxiety, characterized by a rapid heartbeat, sweating, trembling, a sense of impending doom, and sometimes a fear of losing control or experiencing a heart attack. Strokes, on the other hand, occur when blood supply to a part of the brain is interrupted or reduced, leading to symptoms such as sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, as well as confusion, trouble speaking, and difficulty seeing. Treatment for panic attacks may involve psychotherapy, medications, and lifestyle changes, while strokes require immediate medical attention to minimize brain damage and subsequent complications. Risk factors for panic attacks include significant life stress, a predisposition to stress and anxiety, or a history of mental health issues, while stroke risk factors include hypertension, smoking, diabetes, and high cholesterol. Here's a detailed look at the nuanced aspects of these two conditions, delving into their causes, effects, and management strategies. Incidence age, young adults versus older adults. Panic attacks and strokes can present with overlapping symptoms such as sudden onset of anxiety, confusion, or even motor symptoms, but there is a notable distinction in incidence age. Panic attacks are more prevalent in young adults and can be triggered by stress without underlying organic pathology. In contrast, strokes predominantly occur in older adults, often associated with cardiovascular risk factors like hypertension, smoking, or atherosclerosis. While both conditions require prompt attention, strokes constitute medical emergencies, needing immediate intervention to preserve neurological function. The age factor is crucial for healthcare professionals when applying differential diagnosis to these acute events, guiding appropriate management and treatment strategies. Symptom onset, sudden versus rapid. Panic attacks and strokes both present with intense and alarming symptoms, but their onset characteristics play a crucial role in their differential diagnosis. A panic attack often emerges rapidly with a surge of overwhelming anxiety, palpitations, and breathlessness. Despite this quick escalation, symptoms usually peak within minutes. A stroke, on the other hand, manifests suddenly, often without warning, and can produce symptoms such as facial drooping, arm weakness, and speech difficulties. These symptoms result from immediate brain impairment due to interrupted blood flow. Recognizing this distinction in onset is critical. While both require attention, a stroke is a medical emergency, demanding urgent care to minimize long-term damage. Primary symptoms, emotional versus neurological. When differentiating between a panic attack and a stroke, primary symptoms are key. During a panic attack, symptoms are predominantly emotional and physical, but not neurological. Individuals experience intense fear, heart palpitations, shortness of breath, chest pain, and a sense of impending doom. Conversely, during a stroke, neurological defects take the forefront. Symptoms include sudden numbness or weakness, often in one side of the body, confusion, trouble speaking, vision disturbances, loss of balance, and severe headache. Recognizing these differences is crucial, as strokes require immediate medical intervention to minimize brain damage, while panic attacks, while distressing, are not typically life-threatening. Duration: transient versus potentially persistent. Panic attacks generally manifest quickly and are often short-lived, typically peaking within 10 minutes. They present with symptoms like chest pain, palpitations, shortness of breath, and an overwhelming feeling of dread, which can mimic certain aspects of a stroke. Conversely, strokes typically have a more sustained impact. Symptoms such as facial drooping, arm weakness, and speech difficulties can emerge rapidly but tend to persist and may evolve over hours to days. The sudden onset of neurological deficits is a red flag for stroke, and unlike panic attacks, strokes can lead to permanent damage. Prompt medical evaluation is crucial to distinguish between the two conditions and to administer appropriate treatment, especially for a stroke where time is critical. Risk factors: psychological versus cardiovascular. When distinguishing between a panic attack and a stroke, it's critical to understand the risk factors involved. Panic attacks often have psychological triggers, such as stress, anxiety disorders, or significant life changes. They can occur unpredictably, and while distressing, they don't cause physical damage to the brain. Contrarily, strokes are rooted in cardiovascular issues. They are medical emergencies stemming from blood flow disruption to the brain. Risk factors include hypertension, smoking, diabetes, high cholesterol, and atrial fibrillation. In a stroke, every minute without treatment can lead to irreversible brain damage, emphasizing the importance of recognizing these divergent risk profiles for prompt and appropriate medical response.